I am Dr. Belle Jarvis, consultant pediatrician and medical director at the Sir Lester Bird Medical Center. I am indeed elated by the initiative that I've seen here. Definitely the people of Antigua and Barbuda are interested in their health. We know that accessibility to health care is foundational to any country, and what we've recognized is the importance of collaboration. This really could not have been done without United Hands Incorporated in collaboration with the Ministry of Health as well as the Seventh-day Adventist Church, but also the Sir Lester Bird Medical Center, because already we have received referrals from the varying specialities to the hospital, and they have already been integrated into our care. So we look forward to initiatives like these. I definitely think that needs to be more than once per year. We recognize also the power of going to persons in their community so that they can definitely maximize on services that are available. So we say thank you to the public, we say thank you to United Hands, we say thank you to the Ministry of Health, but we also say thank you to the healthcare workers who gave of their time to ensure that persons knew their numbers, to ensure that persons received health education, and I'm happy that the people of Antigua and Barbuda have taken a personal responsibility for health. We recognize as well that as an institution, we also have a responsibility for healthcare, and moving forward, we know that the healthcare of Antigua and Barbuda is bright.
Our entire experience over the last 4 days has been incredible. The surge of people, the outpouring of need, expression of needs, the time that they would show up in the morning, every day it would be earlier and earlier. First started out at 6 o'clock, then 4, then 3. Last night we had someone here at 8 p.m. just so that they could be guaranteed a spot for today. Over the last 3 days, today's our final day, we've seen well over 1,000 people. Now that is not a short, that is not a small thing, I should say, because we're doing procedures. In the dental area, we're doing very involved cases, root canals, oral surgery, simple extractions, and of course restoratives, which are fillings. And those are very time-consuming services. In addition to that, we're doing various visual acuity and diagnostic tests in the eye care center. And then for medical, you got consultations, which the doctors are able to spend quite a lot of time counseling the patients and encouraging them to make lifestyle changes so that they can reverse diseases such as diabetes, hypertension, and heart disease. Now, what we have noticed in common with all these patients as they come for all 3 services, some of them come every day just to get each of those services because it's only 1 per day. What we've noticed is that there's a common theme. They are consuming a lot of refined foods, a lot of sugary drinks, a lot of processed foods, instead of eating natural, unprocessed foods like fruits, vegetables, whole grains, beans. Come on, we have to get back to the basics so that we can take control of our health. This is if we do not eat healthily, we are going to see we're going to continue to see an increase in chronic diseases. Poor oral hygiene. We're going to be losing our teeth. You're going to have to be going to bed with your teeth looking at you in a glass on your night table, and your vision will deteriorate, not due to age primarily, but because of these chronic lifestyle diseases. But besides that, you have been so very grateful. Everyone has been grateful for the services, despite the long wait. We're actually humbled to have had this opportunity to serve the citizens of Antigua. And in particular, again, I would love to thank the Minister of Health. When I tell you he genuinely cares about the residents, the citizens of Antigua, he does. I also want to thank the staff and administrators of the Ministry of Health, those who supported this initiative, those who worked behind the scenes to make sure that we had everything that we need, and we still continue to have what we need even after the clinics are over, from the transportation to the catered meals, which was so yummy, and copies that we needed, just anything and everything. I also want to make special mention, and I hate to call names, but the administrators for the hospital They have been coordinating referrals for ophthalmologic follow-up as well as oral surgery follow-up under general anesthesia. The medical council, the dental council, as well as the nursing council, kudos. This would not have been possible without the appropriate licensure. Thank you to one, thank you to all, but most importantly, thank you to God and to the Seventh-day Adventist Church who co-sponsored this initiative, and to all the volunteers that came out. Oh, EMS, or what is it called here? Emergency Medical Technicians. Oh my goodness, you all expanded our capacity to do all the screenings that we did. Fabulous job. You're brilliantly trained, and I know you learned from us, but it was a symbiotic relationship, and we are indebted to you, the nurses, all the doctors that came out, the pharmacists, just anyone who pitched in to ensure that the residents of Antigua got the care that they so rightly deserved. Blessings.
I'm Dr. Monica Osborne-Stevens. I am the NCD consultant within the Ministry of Health. We are just concluding 4 days of medical missionary for the island of Antigua and Barbuda, our beautiful island. And I am going to tell you, it was awesome. Close to 1,500 persons access services here, whether dental, medical, or ophthalmology, and it has been fantastic. I was really impressed. Persons come out from 3 a.m. to wait in line just so that they could access a service. What these people are doing, the United Hands, it is amazing. I'm someone who loves community work, and so seeing this, it has been fantastic. Busy, hectic during the days, but really, really worth it. And I'm really happy that the government had the foresight, along with even the Seventh-day Adventist Church. They came together and pulled this off, and it has just been amazing. For those of you who came to access service and were not able to be seen, I'm really sorry about that, but we could not see everyone. But I just want to remind you that dental services are available at the polyclinic, specifically Villa, Glanville's, and down at Grace Farm Clinic. So go on out, call them up, find out what time you can go and have your service done if you were not able to get it done here. And remember, the community clinics are open, doctors are there. Go to the community clinics and get your health checked. Okay, this was a one-time thing. We may not see them until a couple of years, but we have a lot of the services here that we can also access. We thank United Hands so much for sacrificing their time and their talents and their resources to come to share so selflessly with the people of Antigua and Barbuda.